Well, hi, Sharon, and welcome to Rebuilding My Health. I'm excited to have you here today to chat about your health journey.
Thanks so much, Casey. I'm really looking forward to this discussion.
Yeah, well, would you start by introducing yourselves? Let listeners know a little bit more about you.
Sure. I am Sharon Surita, the founder of Functionally Enlightened, and I'm a board certified functional diagnostic nutrition practitioner, which is a mouthful, but the acronym is FDNP. But my background is in environmental engineering and toxicology. I work today really at the intersection of environmental and functional health and nervous system healing based on my own chronic illness journey, we can say. So the focus is now helping people uncover those hidden stressors that are driving chronic symptoms like toxic burden and especially implant-related illness.
Right, yeah. And you have a pretty significant story around implant illness, and I would love to go back to when that started, when you were sort of brought into that whole world of yeah,
Yeah.
needing to meet your health challenges.
It was a 180 for me. I had mentioned that my PhD was in environmental engineering. I had received that degree in 2015. So I had my career mapped out, like the next 20 or so years, already knew where I was going to be. I was in leadership positions with the county engineering department. So all of that had been set. But I did have an umbilical hernia mesh. I had an umbilical hernia and I had a ventral hernia, which is like an incisional hernia. And that came from the cesarean that I had with my second child. So I postponed surgery for a while. I wanted to wait till both of my children were kind of old enough, like past the toddler years. So when my younger was 3, I went ahead and opted in for the surgery. However, I received, even though I was adamant against receiving any synthetic material because of the things you hear, there's lawsuits and things like that. So I was already in the know about what to avoid. They did use a hybrid mesh for me, and it was mostly biologic material, but even the small amount of synthetic material in there caused a full-blown systemic reaction in my body, and I never recovered from day one of that surgery. I became bedbound for many months. And, it took many years to actually be able to even leave the home without fear of having a cascade of symptoms. And I can talk about the symptoms that people experience and the ones that I did with foreign body reactions like these, if you'd like.
Wow. Wow, that is crazy. Sounds like it was pretty immediate
Yes.
after the implant. Um, and wow. And you had done your research and they still used the material that you were hoping that they wouldn't, you were hoping to avoid. So yeah, what were the symptoms you were experiencing and what are maybe some of the most common symptoms of this?
Yeah, well, it does affect every aspect of life. So physically, of course, there's the chronic pain aspect, but also emotionally and cognitively and, professionally, of course, because of the cascade here. So what I experienced, they formally diagnosed me with dysautonomia, mast cell activation disorder, orthostatic hypotension, POTS, which is postural orthostatic tachycardia syndrome. So all of these things that are in various organ systems of the body. So we have cardiology issues. There was gastroparesis, which is kind of a delayed or slowed motility. People might see this as constipation, things like that. But the most profound ones for me were the neurologic symptoms. So the very heavy brain fog. I couldn't. There was no way I could do any of the engineering work that I was doing previously. I could barely keep myself in a conversation with even my immediate family. That would have to be very short-lived, maybe 15 or so minutes before I would need to retire to a quiet, dark area. And this includes head pressure that I was experiencing nonstop. Nothing would touch it. They offered migraine support and just a general over-the-counter ibuprofen, things like that. So there was just no pharmaceutical intervention that would cut through any of the noise, any of the pain that I was feeling. And then that POTS that leaves you with a fatigue just for doing simple things like caring for yourself. If you're wanting to shower, for instance, some people have it so severe, such as I did, where I would have to rest after a shower just because the posture, like having to be upright, would make my heart rate so elevated. It felt like I was running a marathon. So I just remember going to a primary care manager, trying to sort through this. And I was like, this person has to help me figure out where to get the help from. And I remember sitting in her office with a resting heart rate of 110, which my normal heart rate would be around 60. And she's like, oh, no, that's normal. That's fine. It's just, you're a little bit stressed here, and it's just nothing to really be concerned about. And that was really disheartening, just kind of to be gaslit to that extent, even from the care team that you think you're going to get the most support from.
Right. Right. Yeah. Um, yeah. And I'm wondering the practitioners you were seeing, the doctors you were seeing at the time following this, were any of them linking your symptoms with the implant?
None of them were actually, and even the surgeon. So, you get about 3 months of time with your surgeon after a procedure like this. It is pretty invasive. The procedure I had was open surgery, so they actually put the mesh in between muscle layers, and it was a full size mesh that covered my abdominal wall. But in the immediate follow-up, I remember the general surgeon telling me I should be fine to do like yoga poses. And he didn't understand why I was complaining of so much pain and how the symptoms that I was having were completely not related with the implant or the surgery. And that, he referred me out to a GI doc at that time. The GI doc did the scans, right? I did colonoscopies, endoscopies, I did testing with neurology. So they just kind of kept deflecting and shifting me to different specialists. And eventually I wound up with a psychiatrist on the team. And that just was I think the last straw for me, because the pharmaceuticals that I was given, again, not touching any of the symptoms, but was bringing on so many more side effects and more cognition issues than even I had prior.
Yeah. Yeah, it was just this cascade of stuff. Sounds like it was hitting like every system in your body, this inflammatory response.
Exactly.
So, how did you then make the shift and like, find some other solutions for this?
Yeah, it took a few years. As I said, just kind of going around the conventional health space. I did find eventually a PCM who is well versed in dysautonomia. He actually was a contributor to the book that is put out by the Dysautonomia Project. And here is where I started researching myself deeply into what the autonomic nervous system is and why I'm having all of these symptoms throughout the body, even though it was a localized procedure, right? I started doing some of the research there. I approached various like functional health practitioners, but still it was kind of piecemealed. It was like do a couple of functional lab tests here, do these protocols, follow up in a month or two. And I did find some help, but it was not sustainable and it was not, I would say that the temporary improvements would end up with regression of symptoms again. So it really wasn't until I found FDN, which was that functional diagnostic nutrition program, that I became more familiar with the labs myself. I learned what a stool analysis could tell me. I learned what an appropriate hormone panel is and metabolites for hormones. I learned about oxidative stress in the body and really started digging into the peer-reviewed literature or knowing what inflammatory responses can look like, and then seeing how the biomarkers from our functional labs were correlating and painting the picture and assessing what I was feeling. And that's really how the whole point approach that I developed, how it kind of came about, just looking at each individual piece, where point, the P in point begins with pre-tox. So foundational. It's not about jumping straight into detox protocols that can make someone herx, that can make them have symptom flares again without having any form of improvement. So pre-toxing is foundational, where we want to lessen the load in the environment as well as in the body before we target anything else inside. And that's really what I learned and what I did with myself before I started practicing with other people.
Interesting. Okay, so explain a little bit more about pre-tox, what that looked
Yeah.
like.
Yeah, so pre-tox ultimately is again, reducing that toxic load. If you want to think about it, some people use the bathtub analogy where if your drains are clogged, that's going to be overflowing with all the things that are coming in. So you can think about your environment first. So think about your water quality. You can check out your municipality and find the water quality report there. And it's quite scary to think of all the things that are still retained in there. They take away the bacteria, yes, but then the chlorine, residual chlorine is in there. You have other compounds like bromine, and I won't go into the specifics, but there are so many compounds that are above a threshold that's considered safe. So water filtration is key. I would always start with water filtration and air quality. Same thing, even if you're in a suburban area or urban areas, we already know of the smog and air pollution there, so we're familiar with that. But even in like farmland communities, there's pesticides and herbicides being sprayed in the air, being carried out for miles and miles for wind. And so we want to work with air quality in whatever environment you are in most of your time. So if it's home, like I was bedbound, like I said, homebound for 2 to 3 years, I really didn't leave the home. So it was so important to make sure my drinking water and my air were clean. So those are just some of the like outside things that can come into our body. You also want to look at the food products, so eating as much whole food as possible that is organically grown, and then farm fresh, pasture raised animal products that are free of the hormone treatments that are in our conventional food sources. So again, just kind of looking at the inputs with food, water, air. And then personal care products are a really big one. If you look at the back of any of your products, I guarantee, unless you've already done this process, I guarantee there's going to be words that are not pronounceable normally, unless you have a chemistry background or something. But you would want to eliminate the synthetic chemicals that you're using, especially if it's a daily used item. Sometimes like toothpaste and face lotions or body lotions, soaps, shampoos and conditioners, anything that has the synthetic chemical names or the word fragrance or parfum, because those are also like xenoestrogenic. They can impact hormones, the endocrine system in general. So we really are looking at those along with cleaning products. So the same kind of thing for cleaning products. You'll want to make sure to eliminate and get things that are more like essential oil based and the common household materials that we would have used maybe, 30, 40 years ago.
Right. Yeah. So that sounded like your pre-tox approach, really reducing the burden on your body in those ways. So then from there, like, were you starting to feel better, and what were the next steps?
Yeah, I started to feel somewhat better. This is where I had a little bit mobility at this point. I could, do more around the house. I wouldn't say I could, do the cleaning chores at this point, but I could see that just changing from the ultra processed foods and making sure I was hydrating well. But again, it was kind of a plateau there after a while. And this was, again, before I started running the functional labs to see where my body actually needed support. But it was around, I want to say 2022, when I started realizing that I hadn't been able to get out of that fight or flight mode that I was in all the time. Like from the moment I woke up to the moment I went to sleep, I always felt like just, I'm not even maybe you can say some type of anxiety sensations, but more just that overlying concern that there's things that are not correct. There's things that are impacting me that can throw me into, a worse flare. And so the pre-tox kind of shifted for me after I looked at all of the external things to looking internally and trying to be more aware of the sensations in my body and allowing myself to move through some of the emotions that came through rather than trying to bottle them up and, be strong and be aggressive with everything else.
Right. Yeah. Yeah. And yeah, fantastic. Yeah, the mind body stuff is so essential. What were some of the practices that you used for that?
So it started very simple with journaling, and it started off with actually journaling symptoms, but at the end of each session, whether it be 2 or 5 minutes of writing, I would try to focus on something that I found beautiful for the day. So if I had noticed, how I felt after each meal. I was really on a very restricted diet because I had oxalate and histamine intolerances at this point. So all of that was noted. But then I would say, I spent 90% of today in bed, but it was a beautiful day outside and I cracked the window and I could feel the fresh breeze coming in and I could see the trees swaying with the wind and smell the fresh air. So I focused on all of those things, especially 2 times a day. So it would be in the morning. I would start my day with this type of um, journaling practice, and then right before bed. So I ended the day thinking about the wonders that were still available for me to either see or feel or touch, and just using all of the senses to kind of understand that I was still an integral part of the world.
Yeah. Yeah, that's amazing. Sometimes those just small practices that don't take a lot of time, but just are regular and very centering make a huge difference.
Mhm.
So, what you mentioned diet. Uh, yeah, what role did diet play in helping you get better?
Yeah, so this diet is a pillar. So in the FDN world, we look at 5 things: the diet, rest, exercise, stress reduction, which we kind of alluded to a minute ago. And then supplementation is always kind of the last thing to bring in. But diet being foundational, the one of the key things there is to look at food sensitivities and also look at the metabolic type. So there's various ways to go about this. One is a questionnaire that people can do and get responses like pretty immediately to understand how their body is utilizing the macronutrients. And this kind of goes hand in hand with the genetic makeup of a person. So you can see um, certain individuals will thrive on much higher fat content versus protein. And then the same thing with carbohydrates. You have either a fast oxidizer or a slow oxidizer, and then you have the mixed, which is, just kind of balanced between them. But a fast oxidizer is going to thrive more on higher content of protein and fat. And if they were to eat on higher carb sources, which is a mistake I made, there was a point that I followed the medical medium protocol, and it works for some. But for me, as a fast oxidizer, I found out why I was feeling worse. It was just not sustaining me. A lot of the raw foods I couldn't break down because I had digestive issues. I just wasn't able to absorb and assimilate the nutrients. And so I learned that I was a fast oxidizer and I needed to shift more to that ketogenic, like the therapeutic ketosis frame rather than a higher carb, low fat diet. And then there's other people that would be the opposite end of the spectrum, that they need more of that fast burning fuel to sustain energy, to feel satiated, and to just kind of be at their optimal performance. So those 2 things I think are foundational. And then the food sensitivity testing can be a whole blood draw. It's the one that I prefer the most, the MRT, because you don't have to challenge the food. You don't have to reintroduce things that you know you were reactive to in the past. They actually test the whole blood cells and see if there's an antigen response to the cells in the lab. So you don't have to do that.
So interesting. So you really dialed in your diet, like according to your biology, what you really needed. So the toxin part, the mind body part, the diet, any other pillars of your recovery that we haven't talked about?
I think the sleep was foundational too. When we're chronically ill, we're either in a state of hypersensitivity and we're just kind of feeling all the things, and we stick to the thought pattern that revolves around how we're feeling then. Or we're in that research mode where we have to figure out things. We have to figure out why this influencer said this is the number one way to go, and it's just not working. So the main thing with sleep and rest, kind of tying those in, is learning how to unplug from those mentalities. And again, using like body scanning and awareness to bring you back to focus. Like one of the practices I do now just throughout the day is just to feel the sensation of where I am, like the feet on the ground, and feel where my toes or my heels are touching the surface of the ground. And the same thing with a chair. For people who are not able to stand, like feel where the back is against whatever item you're leaned against. So that was the rest position, is kind of pulling yourself away from those things that will keep your mind in this loop. But also the sleep hygiene, it goes often overlooked. We say it time and time again, we need to sleep, right? 7 to 8 hours. but yet we're not getting quality sleep. We're sleeping 5 or 6 hours, and we don't have the sleep hygiene that we need to gear us to better produce the melatonin so that we can stay asleep. All of the blue light that we're using nowadays, and we're scrolling on our phones right before bedtime. So those things I had to cut out. And I instituted a 7 o'clock stop for anything with blue light devices. And this, I had to keep it in, oh gosh, like 6 months before I could start to see my sleep being restored. And then if I was using computers after a certain time, for instance, even nowadays, after 3 or 4 p.m., I will use blue light blocking glasses so that the body's response to the blue light, like it will trigger the lack, or it will prevent the body from starting to produce melatonin at the appropriate time, which is where our sleep gets impacted. So I did all of that. Still something I use today is the blue light blocking glasses after sunset. Definitely won't ever stop that. And then on the flip side of that, when waking, again, in chronic illness, we might be waking at very early hours compared to other populations, like well before sunrise. And so the recommendation to get first morning light doesn't really apply, right? So Casey, what I did was bought a sunrise mimicking lamp. And again, I still use this every single day because my biological clock is set to about a 5 o'clock waking time. But I have this thing set to slowly mimic sunrise. It takes about 15 minutes for it to reach the full intensity, which I recommend a 10,000 lux minimum if anyone else is going to use this. So now my body is used to, it has that structure. Bedtime starts at sunset, it will start winding down. And then my sunrise is around 5, I guess 5:30, where now I'm starting to get in a more wakeful state and the cortisol response is what it needs to be.
That is so interesting. Yeah. So you were naturally waking up at 5, and so you thought, okay, well, I'll have this sunrise clock start about that time as well, so that you're getting the morning sun.
Yeah.
Got it. Got it.
Yep.
Even if it's dark outside, you're still getting.
Yes. Now
Yeah.
the caveat is before when I was more ill, it would be like a 2 o'clock waking time. And I would not recommend using that lamp at that time.
Right. Yeah. Wow. Yeah. Yeah. Now you're getting more of that full night's sleep, even though it's an early wake up.
Right.
Uh, uh, wow. Well, how about the role of supplements, anything like that that was really important for you in the
Mhm.
process?
Yes, absolutely. So remember in the beginning, I was seeing different functional medicine doctors, and they would run one lab and, tell me you're deficient in this. You need to take this. Your hormones are imbalanced, so take this. And that really wasn't effective. But when I put in all of the foundational labs together, and I had the picture of all of what we call the hidden systems, so that's hormones, immune, digestion, detoxification, energy production, and nervous system series of labs. We can find out about leaky gut, those food sensitivities I talked about, the state of the gut. So gut health, super important. And then we have the Dutch test or the SHP, stress and hormone panel. So we're looking at cortisol, not just cortisol throughout, like on one point. Most people in conventional medicine will just get that first morning cortisol, but we can see that cortisol response because we're taking 4 to 5 samples during the day. And, cortisol should make a nice curve, like first 30 minutes should be at the peak and then it should come down. So with the labs, I could see that. There are other labs that I now use to monitor my own progress, especially because you can see improved function. And if there's a little bit of a lull again, then you can reassess. But to go to your question, Casey, about supplementation, it was really after I looked at all of those systems together that I could specify, okay, I have a little bit of adrenal complications. And if I could just give myself the support there, the vital reserve that I needed, then that would help me be better prepared to detox. And the detox component, so we have some of those relief care supplements for adrenal health and, digestive support, maybe some enzymes are needed or something simple, probiotics, spore-based probiotics before we do eradication of anything else, especially when the body is in constant immune activation from foreign body responses.
Right, right. Yeah.
Mhm.
So um, adrenal support, probiotics, and such. Yeah, just kind of some good overall body supports. So, Did you, and I'm hearing, let me know if I'm hearing this correctly. It almost sounds like you became a nutrition practitioner in part to heal yourself, correct? Is
Yes.
that like, you're like, I'm going to go back to school and figure out how to do this on my own?
Absolutely. I wish I would have done it sooner. I wish it would have been, and I had contemplated it, but at a certain time, I thought I still needed to be guided. Like we do, if we're so in the trenches, it's helpful to have someone as a guide until you can get the ground or hit the ground and then run.
Yeah, right, right. Absolutely. Yeah. So, tell us how you are today, about your health today.
Yeah, I feel probably 85 to 90% more functional. There are some limitations that I'll have lifelong due to the surgeries. I do have a denervated abdominal wall, which means I have nerve damage on one side where essentially the muscle has atrophied. So I have no muscle on the left side of my abdomen. And that means that I have to wear a binder 24/7 to support the organ weight, to prevent another hernia from happening. I did have the explant. I don't know if I mentioned that, but I had the mesh explanted just, 4 months after it was implanted. And so my just continuing to do research, the only solution for that was more mesh, like to implant more mesh, and that I was adamant against that. So I will, with contentment, live wearing a binder and being kind of mindful of everyday movement while still trying to, that mindset piece again, not have the fear of reherniating.
Yeah, that's interesting. Yeah. So you made the decision to have the explant and not have more mesh put in, kind of because, yeah, I'm sure you're concerned about the additional side effects and continuing to have that problem. So the trade-off is needing to support your abs basically, like for the rest of.
Yeah.
But yeah, sounds like you, yes, but you don't have that all over inflammation anymore.
Right, right. So the Asia syndrome, which is where it lines up very closely to what you and your audience talk about all the time, is that Asia syndrome is what we develop with foreign body reaction, and that stands for the auto-inflammatory autoimmune syndrome induced by adjuvants. So, if you've experienced any type of foreign body reaction, even as small as a splinter in the body that became infected, and you're just like, why? That's the body's, there's that genetic predisposition for the body to want to expel this, but not be able to. And so, if someone has had inflammatory responses or autoimmune-like conditions, any new foreign body that they receive, whether it be, joint replacement or dental implants, hernia mesh, breast implant, that has the potential to provoke this inflammatory autoimmune-like condition. So that is why I kind of drew the line there as I don't want to receive another implant.
Yeah, yeah, very understandable. Sharon, what stats are available on mesh implant illness? How often are people reacting? And I'm sure some people may be reacting and not realizing that it's
Right.
related to the
Yes.
implant.
Absolutely. So there are some studies that are more recent. I want to say around 2022, 2023, more studies are coming out. Dr. Sharon Tofai and her group, she is the hernia specialist for Beverly Hills Hernia Center, I believe it's called. They put out a great paper that explained the population that they serve, where they come in with systemic issues, like I just mentioned. And when they have an explant surgery, there were 60% of them that recovered, almost full resolution of all of these autoimmune-like conditions that they had developed. And the sad thing is, what you mentioned, it can happen as quickly as it did for me, but not often. That's the clients that I serve and the people who have participated in our research surveys most likely had reactions that took, 3 months to 2 years even before they started seeing the connection between when they had an onset of symptoms. And so there's a lot more research out there on the structural defect, like mesh migration, perforation of bowels. There's more research there that shows maybe, I want to say, 18% efficacy of use of mesh to bridge the gap, like it's doing what it's meant to do. And that's why they call it the gold standard. But then those without mesh, there was like 13% to 18% in terms of recurrence. So it's just, there needs to be a lot more research and there needs to be more biologic materials to be evaluated for insertion into the body versus the polypropylene and plastic byproducts.
Right, right. Yes, sounds like it. So the more biological materials, are those available to most people these days?
Yeah, they absolutely are. And the good thing about it is sometimes the hernia won't even require mesh if you go to a hernia specialist. Like they can bridge the gap by doing like an abdominoplasty type procedure where they just kind of fold in the muscle layer on itself and enclose the defect that way. The mesh is just a patch. It's kind of a scapegoat way because it's a faster surgical procedure. They can get you in and out faster. And it does, technically fulfill the needs of the defect, right? We want to close the gap, so they're patching it and they're closing it that way. But going back to your question, to have more biological material, the only issue with the biological material is that it does resorb, and with the studies, it loses some of that tensile strength over time. So there are some studies that show a higher recurrence rate with non-synthetic material, but even even the Phasix mesh that was used in me that was mostly biologic material when I had it explanted, it hadn't degraded at all. It's supposed to resorb into the body, become part of my tissue, and it was still completely intact.
Interesting. That is interesting. So what what advice would you offer to somebody who is either facing um, hernia surgery or surgery where they are given the option of mesh or probably need mesh, or someone after who is experiencing some inflammatory symptoms? Yeah, I guess the words of
Mm.
wisdom.
Yes, you have to advocate for yourself. So if you are just perusing the idea of getting a hernia mesh implant, do your research, really, really get multiple opinions, unless it's an emergent condition like a strangulated bowel or something, like find a hernia specialist that can guide you to what the optimal material to be used if anything is needed. But also the pre-tox component that we talked about before, they don't prep you for surgery the way they need to. Like you have to lower the burden. You have to feed the body the right nutrition so that you can recover reliably. And then just the knowledge, most times they prescribe so many things, so many pharmaceuticals, and then the IV medications that you receive. The body is not prepared for that onslaught, much less the surgical trauma. So really getting your body prepared as much as possible using the pre-tox and optimize part of, what I call the point approach, but anyone can do it. And then if you can work with a practitioner to help guide you, maybe if you have the knowledge yourself, you can obviously guide yourself. I don't know what the proper term is there, but I do recommend working with someone because this is a life-altering thing. Not everyone will have a full recovery after surgery. Most people will be fine, but there's still the body keeps the score, right? There's that book by Dr. what's it, Vanderkirk, where the body will hold on to some of this trauma, and if we don't address it when we can, like in the immediate, then it's going to pop up in different ways throughout your life and manifest with different symptoms and could eventually lead to disease if we don't address it.
Right. Yeah. Yeah. Absolutely. Well, Sharon, you have a book coming out or already out on this. Tell us more about it.
Yeah, thank you. It is called Meshed Up, A Guide to Healing from Implant Illness. It is available in ebook right now, and then the paperback version will be available later on this month. I believe May 28th will be the release date. But it is a book that tells not just on, the pieces what I went through, but it does expand on what mesh implant illness is, what it can present as, and it has a bunch of resources in there including, scripts to take to your doctor so that you can ask all the right questions. And then it goes into detoxing the home, the body, and the mind, which are things that we talked about here, Casey, in your episode. And then we also go into sustained healing. So with functional labs, what you can do with guidance, and then learning the resources yourself, learning about your body so that you can carry that on yourself and be your own best advocate.
Yeah, I love that you have scripts for talking to your doctor because it's so important to know what to ask and really, really do your homework and yeah, know, yeah, know what you're getting into and know that you're making the right decision for
Hmm.
yourself. So,
Absolutely.
yeah. And well, where can people find and follow you?
Yeah, they can go to any of the social media platforms, Instagram or Facebook. Functionally Enlightened is the handle. And then our website is functionallyenlightened.com. So pretty easy, functionally enlightened across the board.
Nice, nice. That does make it easy. Great.
Mhm.
Well, Sharon, thank you so much for sharing your story. This mesh implant illness is kind of a newer one for me, so I am really grateful to be able to bring more about it to the audience and people who may be facing surgery or already in an inflammatory response as a result of and hopefully they can get some hope and inspiration and some education from this.
Yes, Casey, and thank you so much for allowing me to share on your show here. I think what you're doing is amazing. It's giving so many people hope that they too can improve. So I thank you for all the work that you put into this.
Yeah, absolutely. My pleasure. So, nice connecting.
Likewise.